Hi, I'm Blackstone. I'm going to head and I praise the presentation. She's going to member.
Category to be considered highly overweight. And that's kind of less term without the entity. It's responsible for $100 billion insurance, a lot of movies, and the primary thing that a lot of people don't think is obesity is a disease. A lot of people just see it as somebody being overweight, not really as a medical issue, but it's important to realize that it is truly a disease. Another factor is obesity can shorten a woman's life by 8 years, and if you remain your life by 15 years because of obesity. That's a dramatic difference, and you can imagine on what you could lose out with 8 to 15 years of your life. What if you couldn't do an early retirement and that was your chance to kind of relax and enjoy the rest of your life, and that was taken away from you because of a disease? Disease can be necessarily be altered, and you can have the tools to make it better. As part of the obesity epidemic, our current generation right now is actually expected to have a shorter lifespan than that of parents. It's the first for that to happen in 100 significant life and more technology, much more of it yet. We are another thing to remember, this is crazy. Obesity can increase your risk of cancer 2 to 3 times the likelihood. So you're sitting here with somebody with a normal healthy weight, or you're sitting there with somebody with obesity. That person sitting right there with obesity has an increase of cancer 2 to 3 times more than the healthy person sitting next to them. Oh, here's another one. Arthritis. That's something we have to look forward to, as we age, and bone breakdown. Well, guess what? You're obese, you have a 90% chance of getting arthritis versus somebody who's not obese. That's a pretty likelihood that if you're obese, you're probably going to have arthritis. And what else? Oh, wow, this is a big number. I was kind of surprised myself when I heard this one. 300,000 people die each year, annually, related to obesity. Obesity array complicated events, and it's sad that it's the second leading cause of death, but it's preventable.
So it's basically the second leading cause of death and a preventable disease. Not necessarily the overall second leading cause of death. So I don't want that to be misinterpreted. So I did want to kind of go into that. But it's crazy to have something go and be prevented so much side effects. And the way else is additions.
I have heard from many people, numerous people, we can go on diets, we can exercise, we can do things, but yeah, look, BMI is still way too high, obesity is still a diagnostic, in our medical records, so nothing's changing. And the problem with non-surgical approaches is that basically you only lose up to 10% of your body weight, which isn't very much, especially if you have a BMI of 40 or more. 10% is nothing, not enough to do anything. And then on top of that, 95% of the people that lose only that little bit of 10% ain't it all back with 2 years. I mean, I can tell you right now, that's not an effective treatment.
That's just setting you up for failure. So what do we do? Well, gastric bypass gives you that option to lose up to 90% of that excess body weight. Generally, on average, it's 60 to 80%, but it's maintainable. So many patients after the gastric bypass not only lose a great amount of weight, like I said, 60 to 80% of their body weight within the first year, which you can't even do with a non-surgical treatment. But then they go on to maintain that weight loss, and they keep that weight loss, and they keep it off. Yes, surgery sounds scary, and gastric bypass sounds scary because it's surgery. But is it more scary than dying 8 years earlier or 15 years earlier than maybe what you should be, or living with complications such as diabetes, arthritis, gallstones, infertility? I mean, the list goes on and on, possibly developing in cancer at a young age. I mean, these are things we got to look at here. If you are unsuccessful on your own doing a non-surgical procedure, I think it's time that you step up and kind of take a look at the other options that can give you a significant amount of permanent change. I mean, it's in the statistics. And I don't want to keep this presentation too long. I just kind of want to introduce
what obesity is, the effects of obesity,
and a possible treatment option. And if you should have any more questions and want to research gastric bypass, feel free to meet me after the speech and I will follow up with you, or just send me a message. Thanks.